ready.
Okay. Hi, this is Stephanie with Healthcare-Edu. I am going to demonstrate perineal care on our mannequin here. And so we always teach beginning and ending steps. So beginning steps is hand hygiene with a Purell. Gather supplies. I conveniently have my supplies here. Knock, knock, knock. Enter. Close your privacy curtain. All right. And you're going to do your intro. Hi, my name is Stephanie. I'm your nursing assistant for today. I'm here to do perineal care. Can I see your ID? All right, perfect. So you always let the patient know your name, your title. You check their patient identifier and tell them what you're doing. So you can come closer. I'm going to make a clean surface. All right. Some testing locations have you wipe down the table. I teach my students to make a clean surface. I'm gonna take all of my supplies out of the basin here and tell my patient I'm gonna get some water. I'm gonna go get some water. I'll be right back. I'll go get some water. I've gotten the water. Now, for the sake of teaching, I don't have real water in here, but you will have real water during your state exam and obviously in real life. So anytime you get water, there's something that says make sure it's comfortably warm. I'm gonna check the water with my hand, and then I'm gonna have the patient check with their elbow. Can you check it with your elbow, please? How does that feel? Okay? All right. So I'm gonna move this out of the way and I'm gonna raise the bed to my height. And so you would obviously get the water before raising the bed because you don't want to leave the patient with the bed elevated, okay? So I'm gonna raise it to my height here. It's just going a little slow. And this patient actually should have a disposable mattress pad underneath, but it's okay. Okay, so I'm going to lower the side rail so I handle all objects. Now I put my gloves on. So we do, at Healthcare-Edu, we do objects, gloves on, then touch patients, okay? I'm mimicking gloves just because I'm here at the school to save the gloves. So now I am going to tell the patient what I'm gonna do. I'm just gonna clean your perineal area, hold by the ankle. I'm just gonna fan fold the gown up. All right, you don't have to have the patient be totally naked. Now, there should be a pink pad underneath, but now I'm gonna put the disposable mattress pad in the middle just to protect the permanent pad that's underneath. All right, and so now I'm going to clean the perineal area. Women have labia major and labia minor, which leads to 4 creases. And so we're gonna clean top to bottom or front to back, whatever you think, on 4 different spots of the washcloth. So water and soap, this is a bar of soap here, water and soap. And so now I take a corner. Can you all see my students in the background? You can't see them, but top to bottom, turn a different spot of the washcloth, top to bottom, turn a different spot of the washcloth, top to bottom, turn a different spot of the washcloth, top to bottom. Always roll away from you and put in the hamper so you don't touch your gown. And now I'm going to do water. This is the rinse. Imagine being in a shower with soapy water. You don't get out like that. You always would rinse, okay? So this is rinse, water only. Top to bottom, turn a different spot of the washcloth, top to bottom, different spot of the washcloth, top to bottom, different spot of the washcloth, top to bottom. Roll away from you, okay? And so now I would pat dry. I'm going to take this hand towel, and don't get crazy with the towels. If it's another washcloth or a big towel, small towel, I just happen to have a hand towel. I'm going to pat dry. When I pat dry, leave it in the center here. I'm going to close your legs, and now I'm gonna turn you and clean your backside, okay? Sabrina, my nurse, can I have a nurse come stand on the other side? Now, in real life, you're really not gonna get anybody to assist you because the side rails are up, the patient won't fall. But DNS, they want you to ask for that. I don't want you to miss a step. But usually we won't do that unless the patient is extremely heavy. Most patients I could clean on my own. So I've asked the nurse to come stand on the side. She's standing over there. This is how you properly turn a patient's ankle and knee. I'm gonna roll you on the count of 3. Hands on the knee, hands on the shoulder. 1, 2, 3, and you turn. And so the lovely nurse will hold. Now I'm just gonna expose the buttocks here. And so now I have my third washcloth is water, soap. And so this is a bold step. You want to clean from vagina up. Turn the washcloth, vagina up. That's bold. Don't just stay in the buttocks area. Roll away from me, put in the hamper. So if you're looking at the skills checklist, that's bold. If you have a daughter or babysat a little girl or have a niece and you change the diaper, female anatomy is what it is. It's pretty open, so you have to thoroughly clean. So now this is my rinse washcloth. I'm gonna go vagina up, turn the washcloth, vagina up. Okay, roll away, put in the hamper. Now this that was left here conveniently, I'm just going to pat dry. So the direction matters. In the front, it was top to bottom. In the back is bottom up. Make sure, vagina up. I'm gonna roll away from me, put in the hamper. I'm going to remove this disposable mattress pad. This will go into the trash. I don't have a trash in here, so we'll put it here, but it'll go into the trash. So I'll just drop that in here, but it'll go in the trash in real life. I'm going to knee and shoulder. All right, you're all set here. And so now I take my gloves off at this point correctly. You'll see another video with me taking my gloves off. I could touch the objects. And so I'm going to go into my finishing up steps. Would you like the head of bed up or down, just to make it comfortable? All right, up a little bit. So head of bed up. I'm going to lower the bed, finishing up steps. My side rails are up. Bed is low and locked. I'm lowering it, I'm locking it. I've asked patient comfort. Call light within reach. The call light's over there. So the patient has their call light. All right. Privacy curtain open. And now students must ask why, because I took my gloves off, if anything's dirty, but this is a clean surface. So if you take a look, nothing is dirty on this table, right? Because I did things correctly. And so I'm gonna give them their bedside table. I'm going to go to the bathroom, wash this, put this away, and don't forget, this is one of the first 4 skills. That is a soap and water hand wash. We have a different soap and water hand wash video, but it's not Purell at the end, it's soap and water hand wash.